Okay, I'm back. I'm gonna listen to your lung sounds first. Breathe in for me. Why isn't your IV running? Okay, I'm gonna document this. I'm gonna have to call your doctor. I'll be back.
We have witnessed through our clinical rotation that the lack of specific policy leaves a lot of room for errors to be made. Through our research, studies have shown that keyboards colonize bacteria in patients' rooms and contribute to contamination and infection. Not once throughout my clinical rotation at Holy Family did I see my nurse or other nurses wipe down the keyboard. This can also include the fact that there are areas in the room that can become contaminated with pathogens that nurses don't think of cleaning on a daily basis, such as bed rails, doorknobs, etc. Since there is no specific protocol or policy regarding the cleaning and decontamination of patient rooms, a lot of possible issues get overlooked. We found that it would be beneficial in preventing transmission that each room has dedicated equipment, such as blood pressure cuffs, stethoscopes, electronic thermometers, etc., so that the spread of bacteria and pathogens is decreased. However, if dedicated equipment is not feasible, a protocol for disinfecting is necessary based on the equipment itself and the specific pathogen. If nurses adhere to isolation policy, we can significantly decrease the spread of infection. This is a problem that affects everyone in the hospital, especially patients, because patients can be exposed to other patients' pathogens. It also affects all hospital staff, such as nurses, doctors, administrators, or anyone working in the hospital can be exposed to any patient's pathogens. Visitors as well, because they could be exposed to their patients or their family members' pathogens. And the community, whomever is in contact with these pathogens can be carriers for them into the community. In regards to the standard of care, we found the policies listed that the CDC suggests we follow in a healthcare environment, such as isolation policy, nurse cohorting, infection control nurse liaison, institutional safety culture and organizational characteristics, hand hygiene, and education. However, each of these policies are not implemented or carried out in an effective manner. Designating a bedside nurse on a patient care unit as an infection control liaison or link nurse is reported to be an effective adjunct to enhance infection control at the unit level. This nurse would receive and provide frequent training in infection control to increase awareness and compliance on his or her unit, and this nurse will understand its own unit's nuances and challenges and be able to create unit-specific goals.
Ideally, each floor would have an infection control nurse liaison available for healthcare provider education on isolation policy and disinfection technique.
Okay, so we need to remember to put on the proper PPE. So first we have to put on the gown and make sure it is tied. Then next we put on our mask. And lastly we put on our gloves. Now we're set to go into the patient's room. In regards to adherence monitoring, a hospital must have safe policies regarding infection control, but they must also be monitoring that these policies are being followed in practice. The Center for Disease Control suggests that hospitals conduct infection control rounds periodically in high-risk reprocessing areas, such as the gastroenterology clinic, central processing, etc., to also ensure reprocessing instructions are current and accurate and are correctly implemented. Document all deviations from policy. All stakeholders should identify what corrective actions will be implemented. Now that we're done assessing our patient, we need to make sure that we disinfect all equipment leaving the room according to hospital policy and the pathogen that the patient has. And then you need to remember when you leave that you take off your PPE in the reverse order that you put it on. So gloves come off first. Then your mask. And then lastly, your gown. And make sure you hand sanitize your hands before you leave. Studies have shown that computers and keyboards colonize bacteria, so during your care it is extremely important to remember to wipe them down. Providing each patient with their own equipment reduces the chance that that pathogen could spread to another patient through contact with these items. In all healthcare settings, providing patients who are on transmission-based precautions with dedicated non-critical medical equipment has been beneficial for preventing transmission. When this is not possible, disinfection after use is recommended. The use of disposable equipment for patients in isolation can also reduce the spread of infection because these items do not have to be used again. The protocol, according to the Occupational Safety and Health Administration, is to use only disposable trays and plasticware in isolation rooms. However, we have never seen this in practice at the hospitals where we have had clinicals.
Ideally, every isolation patient room should have their own non-critical medical equipment. This includes but is not limited to a thermometer, a blood pressure cuff, a stethoscope, and their own vital